Essential Newborn Care. The ENC protocol is a step-by-step guide for health workers and medical practitioners issued by the Department of Health for implementation under AO 2009-0025, dated December 1, 2009. It aims to ensure health workers have the skills and knowledge to provide appropriate care at the most vulnerable period in a baby's life. In order to establish rapport and earn the mother's trust, introduce yourself.
Good morning, ma'am. I am Rosea, your student nurse for today, and I'm going to assist you and help you before your delivery. Is that okay to you, ma'am? Yes, so how are you feeling today, ma'am? Your cervix is not yet fully dilated, so we will wait. Just relax and calm down so that you'll tolerate the pain of the contraction. And make sure that you won't eat or drink anything before your delivery, okay, mom? Thank you.
Take note that it is not advisable for the mother to eat or drink anything before delivery because of the increased risk of aspiration. Preparing the delivery room.
First is to make sure that the room temperature is at 25 to 28 degrees Celsius so that it will prevent the baby from hypothermia. Notify all the staff. Prepare all the needed supplies.
The supplies are 2 clean towels, 2 cord clamps, resuscitation equipments, eye ointments and vaccine, syringes and needles, sterile gloves, and razor if necessary. Hand washing.
Before washing our hands in sterile technique, remove all the gerbil waste to avoid contamination.
Hand hygiene is one of the most important elements of infection control. The aim of hand washing is to remove transient microorganisms acquired through cross-contamination. Double glove just before the delivery.
At the time of the delivery, encourage the mother to push. Go, ma'am! Inhale, exhale, and push! Inhale, exhale, and push! Go! You can do it, ma'am! Go, one more! 1, 2, 3, and push!
Now put a clean dry towel on the abdomen of the mother in preparation for drying the baby. Then apply perineal support and control.
Go, ma'am! Inhale, exhale, and push! Inhale, exhale, and push!
Baby boy out at 10:30 p.m. Dry the newborn thoroughly for at least 30 seconds. Wipe the eyes, face, head, front and back, arms, and legs. And do a quick check for breathing while drying. Remember this, do not ventilate unless the baby is not breathing. Do not suction unless the baby's mouth is blocked.
Remove the wet cloth. and put the baby into the skin-to-skin contact
on the top of the mother's chest. Put the blanket in the bonnet to keep the baby warm. The benefits of skin-to-skin contact are promote mother and child bond, breastfeeding success, lymphoid tissue system stimulation, exposure to maternal flora, protection from hypoglycemia, and thermoregulation.
Let us now palpate the mother's abdomen so that we can prepare for the oxytocin injection.
Oxytocin is important because it prevents hemorrhage or excessive bleeding after the vaginal birth. Cord care. For the cord care, first is to remove the first pair of gloves. Now we have to palpate the umbilical cord. After the pulsation stops, clamp the cord using a sterile cord clamp at 2 cm from the umbilical base. You can milk the cord away from the baby gently or slightly. Then clamp again at 5 cm from the umbilical base. You can now cut the cord just near the first cord clamp. And after that, check for the 2 arteries and 1 vein.
At this time, perform all the necessary nursing management for the next stage of labor. Wait for another strong uterine contraction and encourage the mother for one more push for the delivery of the placenta. We have to massage the uterus of the mother to stimulate uterine contraction for the delivery of the placenta. And next, check for the perineum area if there are any lacerations. After the placenta has been delivered, examine and check for the abnormalities and the completeness of the placenta. The placenta is complete and has no abnormalities. And now, we have to clean the mother by flushing the perineum and applying cloth, napkin, or perineal pad on it. We have to check also for the color and breathing of the baby. The color and breathing of the baby is normal. Check also for the comfort of the mother. Ma'am, are you comfortable with your position right now? And now we have to dispose the placenta in a leak-proof container or in a plastic bag.
Always remember to decontaminate in 0.5% of chlorine solution all the instruments before cleaning. The second glove must also be decontaminated before disposal. This should last for at least 10 minutes.
Advise the mother to maintain skin-to-skin contact, and the baby should be on her chest or in between her breasts, and make sure that the head is turned on the one side. Also, advise the mother to observe for breastfeeding cues. Hello mom, so please maintain skin-to-skin contact with your baby, okay? And please observe for some breastfeeding cues such as mouth opening, lip licking and sucking, bringing his hands to his mouth, moving his head as if he is looking for your nipples, and clenching of face and hands over the tummy, and bending his arms and his legs and fuzziness. Okay, ma'am? Support the mother and instruct her on positioning and attachment, and wait for full breastfeed to be complete. After the breastfeed is complete, apply eye ointment to protect the baby from unknown gonorrhea infection in the mother's body. The next is do a thorough physical examination. We will now administer vitamin K intramuscular to prevent the baby from serious bleeding, also known as vitamin K deficiency bleeding. Next is the Hep B vaccine. It is the early protection of the baby from hepatitis B virus. And lastly, the BCG vaccine, intradermal. It will protect the baby from any serious forms of tuberculosis. So ma'am, how are you? I advise you ma'am to bath your baby after 6 hours, because delayed bathing can provide you a longer skin-to-skin contact with your baby. Is that okay ma'am?
Take note that early washing hinders crawling reflex and can lead to hyperthermia, coagulation, defect, acidosis, delayed fetal to newborn circulatory adjustment, hyaline membrane disease, and brain hemorrhage.
Whenever your baby wants to breastfeed, just breastfeed him. Okay ma'am? Okay. Thank you. In the first hour, check the baby's breathing and color, check the mother's vital signs, and massage the uterus every 15 minutes. In the second hour, check mother-baby dyad for every 30 minutes to 1 hour. And lastly, complete all the records.